CoolSculpting, and CoolSculpting is an FDA cleared treatment that actually kills fat cells. So if there are areas of stubborn fat that you want to get rid of, CoolSculpting is a great option. So I like to tell people, as long as it's squeezable, it's freezable. So CoolSculpting targets subcutaneous fat. It does not target visceral fat. And the way to tell the difference is that visceral fat is underneath the muscle. So CoolSculpting cannot treat any fat that's under the muscle. So for example, if you know somebody that's got more of a firm stomach and it's not a squeezable stomach, it's just kind of firm, that fat is located under their muscle and we can't treat it. Now, if they had some fat that was hanging down underneath that belly that is squeezable, that's perfect for CoolSculpting. So there are 9 different areas that we can treat with CoolSculpting, and these include the arms, under the chin, the abdomen, the love handles, inner thighs, outer thighs. There are so many spots, but they must be squeezable. So I'm going to show you a typical back treatment. So we're going to come on in closer, and I'm going to show you how this treatment is applied. So our beautiful patient is getting it done today. We've already marked the area that we are going to treat. It's right here, and this is where our applicator is going to go. So I'm going to wipe off her skin with this skin treatment wipe. I'm actually going to go a little bit above where I marked, so just might take the markings off right now. And it's very important to go to a place where people have done CoolSculpting before, the providers, because there is an art to applying the applicators. If you treat in an area that, if you don't map it out correctly, you could get little indents in places that you don't want. So it's really important that you go to a very experienced provider. So anyhow, okay, so we wiped her off with the skin cleanser, and that is to remove any oils from her skin and to prep her skin. Now we're going to use this lovely gel pad, and this is what's going to prevent her skin from freezing. So, sometimes people will say, oh, I don't need to do CoolSculpting, I'm just going to put, ice packs on me. Well, you're going to freeze your skin and you're not going to target your fat. So this CoolSculpting will not target your skin because they have this great pad here. Okay, you ready? It's kind of sticky and icky. 1, 2, 3, here we go. Alright. So that is beautiful. And it feels gross, but this was the main hang-up to getting CoolSculpting FDA cleared, is because they couldn't figure out how to protect the skin. But then, 15 years ago, they figured it out, which is great. Everybody's happy about that. And now we can all enjoy CoolSculpting. So we have our machine is on, our vacuum is on. We already indicated where we're going to treat, and we're going to apply the applicator. Okay, you ready? All right, 1, 2, 3, here we go. So grab it. Ooh, I love that. This is so good, yeah. Okay, so now I'm just going to strap you in. And we like it nice and tight so it doesn't come off during the treatment. Grab that other one. Perfect. Does that feel nice and tight?
Oh yeah.
Perfect. All right, I'm going to put some pillows around you now. You don't have to sit like that the whole time. Okay, and let's bring the head up. It's all about positioning here. Okay, why don't you lay back now? Now that we got her all comfortable, I'm going to go ahead and start the machine. So here we go. And you're going to start to feel it get cold. And then over the next 5 minutes, you're going to get numb, and then you're going to feel nothing.
Perfect.
It's going to be great. And all those fat cells are going to be like dying and crying, and then eventually, so what happens right now is the fat cells get stunned for the next 35 minutes. And then over the next 3 to 4 days, they're going to burst and die. And then your macrophages, which are the garbage men in your bloodstream, they're going to come and take that debris, which were once your fat cells, process them through your liver and out through your stool. So you're going to poop out your fat cells. Perfect. Great. Never to come back. So the only time you make fat is when you're born, puberty, and pregnancy. Okay. So if you're done with that, you're not going to make fat cells again. Now, if you were to gain 100 pounds in a month, you're going to make fat cells again. But most people don't do that. So this is a great long-term treatment. And especially even if you're doing like the GLP-1s or other kind of weight loss regimens, when you lose weight, your fat cells get smaller. then when you gain weight, the fat cells get bigger. CoolSculpting actually destroys the fat cells, so they can't come back.
Love it.
So if you were to go to Spain, for example, and you were to go and drink all the wine and eat all the bread, I guess if you're going to Italy, you'd probably do that, but maybe in Spain too, and then you were to gain, let's say, 10 pounds, you may not notice it as much in your back because that's where we're treating.
Okay.
But you might notice it more in like your butt or your belly or somewhere else that doesn't have as many, that has more fat cells than your back does now. So every time we do CoolSculpting, we kill 20 to 25% of your fat cells. So most of the time we recommend, all the time we recommend 2 sessions spaced anywhere from 4 to 8 weeks apart. Sometimes we do 3 or 4 sessions. Really depends on your goal and how much we treated at one time. So there's different size applicators for different people. Obviously this applicator worked really well for you, but there's different ones for like inner thighs, for bellies, obviously I can't use the one on your back, for under your chin. So lots of applicators, lots of choices, very individualized. And then you start to see results in about 3 weeks. We will see the final results in 3 to 4 months.
Perfect.
Outer thighs take a little bit longer, so it's always about 4 months after for outer thighs. What else can I tell you? I don't know. I mean, it's pretty easy. How does it feel?
Perfect.
Does it hurt? Are you
Cold.
stingy? And
Feels like your hands when they're cold and they thaw inside.
Yeah.
You know?
Yeah.
But this is my fourth time having it done.
What did you see with your first?
I love it.
Yeah, I know, it's addicting, isn't it?
It's super addicting.
I've done it like, I think now 48 times.
Yeah.
I mean, literally. So anyway, so you could just sit here, watch some Netflix as your fat cells die.
Perfect.
I love it so much. So our beautiful patient will sit here for 35 minutes. On this particular applicator, some can be as long as an hour and 15 minutes for outer thigh. Underneath the chin is 45 minutes. Anyway, it's really pretty quick in the greater scheme of things. So you could do it during lunch if you wanted, and you could go back to work. There's nothing to do afterwards for the aftercare. Really, I don't want you to go sit at home and eat bonbons. That's not really in the aftercare. But tomorrow you could work out. Even today you can go work out. So there's no downtime from this whatsoever. You might have some like tingling. It might be numb for a little bit. Whatever. It's all going to go away, including the fat cells. There are other machines that use heat. We don't like that because that is really hot and it really is painful. When you use cold, you just go numb. And this has been around the longest. It has so many white papers about it, and it's one of the very few machines that actually shows that fat cells actually burst and die, which is what we want. Like I said, you can couple this with the GLP-1s. So if you've lost a bunch of weight, but there's still a stubborn area, CoolSculpt it. If you have gotten liposuction before and there's a little area that's left over, a little pocket, we can CoolSculpt that. You don't have to undergo any further surgeries. You can just CoolSculpt it away. So super easy. I'm excited that you love your results so far. We'll have to post some results of your previous treatment so that way people can see it. Then we'll obviously post this too. But if you want to find out more about CoolSculpting or about any of the other procedures we do at RejuvenationMD, you can find us on YouTube, Facebook, Instagram, and online at our website at RejuvenationMD.com.